So, Chris, what is your experience with your surgery for weight loss?
Well, back in 2013, I struggled with my weight my entire childhood, but back in 2013, I ended up getting what they call the Roux-en-Y gastric bypass. And from the very first day that I was released into pre op, I started having complication after complication. The anastomosis, the scar tissue, everything just kept building up. And eventually I started having reoccurrent ulcers that would eat through the surgical lines. So they would have to go in, and over the span of because it was the end of 2013, over the span of 2014 into 2015, I spent almost weekly, week long instances into the hospital being admitted because they would have to reconstruct portions of my stomach or because I was having blockages, just various things. Some of the times my potassium would end up getting so low because I couldn't absorb nutrients that they would have to take me into the emergency room to get me these bags, like multi-liter bags of fluids, because my potassium was critical. But all of that also, tied in with the weekly appointments, being admitted into the hospital for all of this reconstruction. I also ended up getting addicted to opiates, and that run lasted, from 2013, mid 2013, all the way into 2018 when I finally got help and, have been clean since then. But I would definitely say that anybody who's looking to get gastric bypass surgery or the sleeve or any of these little rings that they put around your stomach, it's they call it the easy way out, but it's definitely not the easy way out. There were many a times when I was in the hospital, like with that crashing potassium, that I was told that I could have died because of my heart rate or just the malabsorption and the malnutrition issues I had. It definitely wasn't the easy way out. And if I were to look back at all the struggles I've had since 2013 into 2018, it was just not worth all of the side effects for drug addiction and all of the multiple surgeries and just all that lost time with myself, my family, and just the pain of it as well. I mean, drinking 20 mLs of water was almost impossible at times. So I would just caution anybody who's looking into doing that just to really rethink all your options and look for alternative treatments first.
Is there a way they can reverse the surgery?
There is a way that they can reverse the surgery, but nothing that works the way your body previously did. So essentially, it's tissue that allows more into your stomach space, but it does not absorb the way your normal stomach would. So while they say it's quote unquote reversible, it's actually not reversible because it's just tissue, not functional tissue.
So, what is the alternative, you think?
The alternative, honestly, is going back to your normal self. I mean, it's going to make you sick, but there are people that have been known to, even after they have the surgery and they lose drastic amounts of weight, their stomach just re-stretches back out, and all of that effort, all of those side effects just end up becoming for nothing, and you can regain the weight in addition to, going through everything that you went through. So the alternatives are eating right, exercise. I really, as a man who was in the jobs that I was in, that were considered manly, never really looked at it. But, even meditation and yoga and things like that, there's just so many different things that you can do that are better for your body as the time goes on and you lose that weight, rather than just shocking your system and saying, hey, you can no longer perform or absorb or do anything that you used to be able to do, normally. Because as you yourself know, Dr. Farag, I mean, that nutrition and that absorption, just the normal operation of the body, is a requirement, for life.
Yeah, and some people think that this part of the stomach is not necessary or they can live without it, but every part in the body was created for a reason. You
Correct.
can't just take it out, even if you can't lose weight. This is not the answer. The answer is to self control what you're eating, and that's why I dedicated my channel to healthy lifestyle to prevent those unnecessary surgery that you can even die on table from it.
Yes, ma'am.
Okay, thank you so
Thank
much.
you, doctor.
Okay, bye.